Good morning to you, Mr. Bloom. Always a pleasure speaking to you. If any of this, even a portion of this, is true about what's happening in that cancer unit at the hospital, this is not just worrying, it's mildly terrifying for these patients.
Well, absolutely. This is official information. So they have a 40% staff shortage to serve 1,300 cancer patients. And now the unit's actually been closed because the hospital's been closed for more than 6 weeks because of the fire. The chemotherapy patients have been sent to the Chris Hani Baragwanath Hospital, the radiotherapy patients to the Steve Biko Hospital. But, there's already backlogs at these hospitals to start off with. And there's inevitably delays. And I'm afraid lives are at risk. It's a very serious situation. The cancer unit at the Charlotte Maxeke Hospital was already struggling, and now everything's gone much, much worse.
And what's the timeline for trying to get this back online? We've obviously identified the problems. No doubts, Mr. Bloom, there'll be arguments about costing and having to restore what was damaged, but there must be a timeline in mind. If not, I'm sure you demanded one.
Well, yes, I have, and it's extremely frustrating that the hospital hasn't opened the sections that have already been judged to be safe. We don't know what the delay is because it's essential that in the middle of this COVID-19 epidemic, we have a functioning hospital, at least those parts of it that are structurally safe. But I think the solution is already alluded to in the reply that I got from the Health MEC. They're negotiating with the Netcare private hospital group to treat public patients for cancer in a private-public partnership. I think this is the way forward, especially now since the cancer unit is effectively closed. Why not pay the private health sector to treat cancer patients in the public sector? I really think they need to find funds for this as soon as possible. It's an emergency situation. This will definitely save lives.
The issue, it seems, though, Mr. Bloom, is this isn't something new. This wasn't only an issue once the fire had broken out. There were complaints about this, weren't there, about the facilities at Charlotte Maxeke Hospital, not just the cancer unit, just generally run down, a shortage of staff, machines not working or out of date, etc. So all that's happened here, I'm sure you'll agree, is the fire has highlighted the problem. But this has been a long-standing issue, hasn't it?
Yes, look, there's always been a problem with that hospital with poor maintenance. A few years ago, a ceiling collapsed. And the backlog of maintenance, the cost to fix it was about 400 million rand, and they hadn't even budgeted for it. So there were constant complaints that every time it rained, the pipes were leaking. And it was a serious situation. And now, with part of the hospital seriously damaged, we still don't have an estimate of how much or when they're going to fix it and how much it would cost. So I think that we need clarity urgently. We need to sort out the fire safety issues. Apparently what's holding it up is the city of Johannesburg. I really wish that they would do whatever they can in the shortest possible time to open up this hospital. It has 1,000 beds, which we desperately need now that we're in the up phase of a terrible epidemic.
Oh, just before I say goodbye to you, I have one more question, but I do want to just let viewers know we have tried to contact the Gauteng Health Department for an update on this situation, as is Jack Bloom trying to speak to them on what is happening at the hospital. We were told no one is available to comment. Mr. Jack Bloom, I leave that comment with you as I ask you this. Patients of that hospital watching you and I speak at the moment, what do they do if they go there today trying to find their cancer unit and get their cancer treatments?
Well, this is a major part of the problem is the lack of communication. I have cancer patients contacting me, and I try to assist them to put them in contact with the department. They tell me that they phone the hotline and nobody answers. And there's also a medicine shortage. People are not getting the medicine that they need. They're told to go to other health facilities, but they don't have it. So I'm constantly fielding calls trying to assist patients. And the department really should at least make sure that all their hotlines are properly staffed, they give accurate information, and that we have alternative plans. And this is what I've continued been pushing for at the Gauteng legislature. I just wish that the department would be truthful with us and tell us what the real situation is.
I'm sure many people would agree with you. As say thank you to DA Gauteng Health spokesperson Jack Bloom. As mentioned, the Gauteng Health Department, we've tried to contact them for some kind of update on the situation. If anyone from Gauteng Health is watching, even the Health Ministry itself, please get hold of us. We'd love to know what is happening at that hospital. There's so many patients who desperately need to understand what is going on.